Hello, my name is Taryn, and I will be presenting on eating disorders. This presentation will focus on the top 3 eating disorders: anorexia nervosa, bulimia nervosa, and binge eating disorder. Here is a table of contents that will give you a layout of how this presentation will go. The first section will introduce eating disorders. Here, eating disorders will be defined, examples and symptoms will be given. In the second section, causes of eating disorders. This will explain the causes of eating disorders and how social media plays a part. Section 3, treatment, recovery, and research. This will show the ways that treatment and recovery works and what research and advances have been made for the benefit of eating disorders. Section 4 will be the references, and it will show the websites and articles used to build this PowerPoint presentation. Section 1, introducing eating disorders. What are eating disorders? In short, eating disorders are defined as physiological disorders that are determined by abnormal or disturbed eating habits. 28,800,000 people have suffered from an eating disorder in their lifetime in the United States. 10,200 individuals have died from a direct result of an eating disorder. What are the most common eating disorders? The top 3 most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. What exactly is anorexia nervosa? Individuals who suffer from anorexia nervosa put dietary restrictions on themselves for the purpose of weight loss and the fear of gaining weight. This disorder is physically and emotionally straining on them. Anorexia nervosa can result in health complications, and without treatment, even death can occur. What is bulimia nervosa? Individuals who suffer from bulimia nervosa typically eat a large amount of food and then try to remove the food by vomiting, using laxatives, weight loss supplements, fasting, and excessive exercise. This is referred to as binging and purging. This disorder takes a toll on the affected individual, causing unhealthy eating patterns and low self-esteem. What is binge eating disorder? Similar to bulimia nervosa, sufferers of binge eating disorder eat large quantities of food at a time, known as binging. During this binge, they typically feel a lack of self-confidence or control, even though they might feel uncomfortably full. After this binge occurs, individuals are left feeling ashamed or disgusted with themselves. Binge eating disorder is typically a newer recognized eating disorder compared to anorexia and bulimia nervosa. In some eyes, they don't look like they might have an eating disorder, so uneducated individuals might judge them more, thus putting more strain in the affected individual with the disorder. And this makes it harder for them to get treatment, because if their peers or family are like, you don't have an eating disorder because you don't look like it, then this might make treatment have more obstacles in the way, and the individual even more succumb to the illness or disorder even more. Here we'll talk about the symptoms of anorexia nervosa. The first symptom is over-concern with body image, weight, and calories. Cooking for everyone else, but not eating it themselves. They always say that they aren't hungry, even though they might be. They have low muscle mass, and they could lose or have less frequent menstruation. Loss of bone density and increased body hair. Low body temperature. So they have low body temperature, so that's why they have increased body hair. Here are some symptoms of bulimia nervosa. They have poor body image and over-concern about weight. They purge after eating. They have loss or less menstruation. They have damage to the teeth, mouth, and gums from self-inducing vomiting. Depression, dehydration, and eating more food than normal. Going to the dentist can actually help individuals who have an eating disorder, but maybe they are not comfortable telling their family and peers. The dentist can actually see the damage to your mouth and teeth and talk to you or the parent about it. Here are some symptoms of binge eating disorder. Individuals with binge eating disorder have poor, distorted body image. They eat large amounts of food in one sitting, most likely a food that the person would usually avoid. So they may have a food that they cut out or they want to cut out, but eventually they, by not wanting to eat that food ever, like let's say a cake, they don't want to have cake because they know that maybe it will make them fat in their eyes. So they will completely forbid this food. But by forbidding this food, they will think about it and think about it and think about it. And then eventually they will eat that certain food and keep eating it at one setting. And this will make them feel very shameful. Binge eating disorder sufferers also diet and fast after eating because they feel shameful after their binge. They also overexercise, and they may have swelling of the hands, feet, cheeks, and face. Here are some myths about eating disorders. Myth 1. You have to be overweight to have an eating disorder. That is false. The truth is, typically, being underweight is only associated with anorexia nervosa. An individual with an eating disorder can have a healthy weight or be overweight. Myth number 2. It is a choice to have an eating disorder. That is false. Truth is, eating disorders are an illness. It is a disorder that affects their mental health. Most individuals feel shame with their disorder and would not choose to suffer through it. Only young girls suffer from eating disorders. No, but the truth is, individuals of all races, ethnicities, sexualities, classes, and weights suffer from eating disorders. Because of the assumption that only girls get eating disorders, it is harder for the rest of the sufferers to get support and thus face barriers to treatment. Section 2. Causes of eating disorders. What are the causes of eating disorders? The cause of eating disorders ultimately depends on the type of disorder and the individual who is suffering. Genetic, biological, and environmental factors all play a role in causing these eating disorders. Judgment about body weight and or eating habits, whether it come from the individual or the peer around them, are a main cause. Society's pressures for individuals to be slim. Anxiety and depression can cause eating disorders, low self-esteem, and poor body image. Other individuals in the family who also have an eating disorder and pass down these behaviors or traits to them. Or people who suffer from eating disorders, when they lose weight, losing weight is not always good, but the parents or peers might encourage this to the sufferers, praising them for the weight loss. So this might be another cause of encouraging it. All three of these eating disorders have an underlying tie: poor self-body image. I would like to expand on why people negatively view their body image, specifically looking at the fault of social media. Social media. We all know that social media has an impact on our day-to-day lives. I know that when I wake up, along with many others, one of the first things we do is pick up our phones and browse on social media. Think about how this sets the tone for the rest of the day. We are influenced by new fashion trends, the latest technology, and share common beliefs with individuals around the world. We all want to feel good about ourselves and keep up with the world, even if it affects our mental and physical health. We aren't just influenced by what people do or say, but what they look like. Society has always told us that thinner individuals are more successful and happy. The biggest proof of this can be seen in apps you scroll through daily. I've seen overweight individuals be shamed and thinner individuals be praised on the daily. I've seen posts glamorizing eating disorders and comment sections filled with sizeism. Sizeism is size discrimination. To prove just how much social media impacts self-body image, I have made a voting poll that I have personally posted on a social media platform named TikTok that shows the individuals whose body image have been negatively impacted by social media. The question I posted was a yes or no poll, and the question was, has social media ever negatively impacted your self-body image? Yes or no? Out of the 74 individuals who took a part of the poll, 69 of those participants agreed that social media negatively impacted their self-body image. That is 93%. That many people found discomfort in their own body just from being on social media. Here I have a form of a chart that shows just the difference of the yes or no answers. 7% or 5 people said no, 69 people or 93% said yes. Along with voting for the yes or no poll, some individuals had some comments to say themselves. Here is a quote from an individual who took part in my poll. They said, "There is so much opportunity for comparison on these apps. We see ourselves at the most vulnerable states and see others at curated perfection." Here's another quote of a participant of my poll. They said, "Social media is a breeding ground of unrealistic expectations in people. As someone who has a severe ED, which means eating disorder, I try to stay off Instagram religiously." Can social media be used for good? I believe that social media can redeem itself for the damage it has done. Encouraging body positivity, embracing differences, and educating more people, especially young children, that social media's tank on beauty doesn't even scratch the surface. Though this is a great start to a better self-image, some individuals have already succumbed to the harsh judgments of society. Many of them also suffering from eating disorders. In this case, avoiding social media might be the best option until a full recovery is made. Treatment, recovery, and research. Section 3. Treatment and recovery. A healthcare professional will diagnose and create a specific plan for the individual. This will depend on the individual, their eating disorder, and what will work best for them. A strategy that is commonly used is cognitive behavioral therapy, or CBT, which helps build a new way of thinking and stress managing. Therapy for an individual or family might be a part of the treatment. Nutritional therapy might be a part of the treatment. Anxiety and depression medications could be prescribed as long as supplements for deficiencies. And if the eating disorder is very severe or far taken along, hospitalization might be necessary. If you or a loved one feel like you may struggle with an eating disorder, you can call or text the NEDA helpline for support, and the number is below. Now, researching. Now that more individuals are starting to understand eating disorders better, they are realizing that more changes and advances are needed. Recently, many neural treatments are being explored for eating disorders. Some of these include real-time functional magnetic resonance imaging, deep brain stimulation, and magnetic stimulation. Following the research of expected neural treatments, further advancements have already been made towards eating disorders. A new prescription named Vivanase, hope I'm pronouncing that right, is used to help treat binging eating disorders. It was shown to decrease the severity of binge eating disorders when a controlled study was performed. Integrative therapies have also been found to be more helpful and are newly advancing. These mindfulness-based interventions have been considered to be helping binge eating disorders by reducing them. 19 studies have been done to conclude this, but since they are only lasted for about 3 to 6 months, more follow-ups will be conducted. Section 4. References. Here I have included the references and resources that have been used to conduct this PowerPoint. I really appreciate you watching this PowerPoint, and I really hope that you have enjoyed it and learned something new.